Good afternoon. We are here to update you on the city's response to the COVID-19 crisis. But before we get into the details, and we have a number of slides for you, I want to emphasize that this is something we're doing very important together. And what we're doing is we're working together to help contain the spread of the virus and to save people's lives. Now, this is not easy. There are many people making a lot of sacrifices. It is not easy to stay at home, to close down our lives and not go out. And for many people, they face unemployment and financial difficulties as well. So this isn't easy, and certainly I understand that. But I am determined that if we work together, if we do what we should, that we will ultimately and we already have, but we will ultimately have even a greater effect in terms of limiting the spread of the virus. Now, we know that wearing masks is very important, and we're going to get into the details of that and some of the other steps that we know need to be taken. But do we want to wear masks out in public when we go to the supermarket, to the store? No, certainly not. I mean, I don't enjoy it, but I am committed and determined to work with you, work together to save people, to limit the spread of this virus in our community. We know that also that this is affecting people over 60, seniors, people over 60, more than others. And this is an unfortunate feature, not that we want no one to be affected, but this is an unfortunate feature of the COVID-19 virus. We've had some nursing homes, congregate living facilities that have been hit hard, both in Nashua and across the state. The majority of the people who have died in New Hampshire, and there's 170 or so, have been over 60. In Nashua so far, we've had 10 people die. They are predominantly over 60. Some people have said nationally that, well, what's the difference? They're about to die anyway. Well, this is a point of view that I strongly, strongly disagree with. It is our moral duty to save every person we can. I have a friend who somehow contracted the COVID-19 virus and is now on a ventilator that's called intubated. And his family is certainly, I'm sure, suffering enormously. And he could have many years to live if he can get through this crisis, his health crisis right now. So our moral duty is to save as many people as we possibly can. Now, of course, we can begin to see the light at the end of the tunnel in the sense that the state, under the guidance of the governor and the State Department of Health and Human Services, is beginning to gradually open some of our restaurants and other activities that have been closed for at least a couple of months now. But we don't know, the reality is we don't know what's going to happen. We don't know if this is going to be the end or if the virus will reemerge later on, like in the fall. Many experts say that that can happen. And we know that as people begin to gather together, even in small groups, restaurants and other places, even outdoors, it could lead to the spread of the virus to some degree and could lead to a reemergence of a greater number of cases. But again, we don't know what's going to happen, so we need to use our best judgment, follow the advice of our medical people, our experts, our healthcare experts, to try to find our way out of this situation. I mean, I know that in the end, our community, our economy will recover, but we don't know when that's going to happen, and we have to be frank and honest about that. Now, I want to show you some of the detailed information about what's going on here in Nashua and across the state. And we've got a number of slides that we're going to show you. The first slide is entitled COVID-19 Case Update. This just gives you some of the numbers that you may already know. but I'm focused mostly on New Hampshire and on Nashua. There have been about 3,700 cases in New Hampshire. 10% of those have been hospitalized. 5%, again, tragically have died. If we go to the next slide, I just thought I'd throw a photo in here so you can see what our great public health professionals are doing. Here's a couple of photos showing one of our testing sites where people can show up and be tested. And again, you've seen, you know, and you will get the figures. I'll show you the figures on approximately how many people have been tested across the state. But I want to thank our public health professionals who are on the front lines for doing this very frequently. Here in Nashua, our public health department ran a testing clinic yesterday. There's going to be one tomorrow. Director Bobby Bagley, Director of Public Health and Community Services, is here with me, and they will be running another testing clinic tomorrow. But that's how it gets set up. You can see that in the photograph. Now we're going to go to a slide entitled Nashua COVID-19 Case Update. Now what this tells us is that right now we have 363. I think that this is slightly out of date. It's a little over 370 cases in Nashua. We have 94 active cases, meaning most people have recovered, but, as I mentioned before, tragically 10% have died. 73% have recovered, and about 10% of that total have gone to the hospital. Now, our hospitals are in pretty good shape. Right now, there are about 10 people between the two hospitals that are in with a COVID-19, that are COVID-19 positive, that are suffering from this virus. That number has been 15 or 20 in previous weeks, so that number is down a little, and of course, that is good news. The next slide shows you the new cases per day. And this is the number of people who have tested positive in Nashua on a daily basis. And it goes back into March. And you can see that the numbers are up and down. The highest day was almost 20 people tested positive. But we're not running clinics every day, so you really have to kind of look at the trend. And you can see that it's potentially beginning to come down a little bit, which is good news. And certainly there was one day when it was way up, but overall, I'd say there is a stable or a slightly downward trend. The next slide is going to show you a couple of things. On the left is the New Hampshire testing. This shows you the number of tests that have been conducted in New Hampshire. Now, the number has gone up dramatically. At the beginning, tests were very scarce. Now, far more available. And what this shows you is that and it's the graph that goes up, over 50,000 people have been tested. Now, we know that testing is critical because it helps us to determine who may have the disease, and number two, how widely dispersed the infection is. So this is a good start, but we really need to get a lot more testing done. And there is an antibody test now as well that shows who has been in contact with the virus and has recovered, potentially with no symptoms. Now, what we have on the right is persons being monitored for COVID-19. Now, these are Nashua-specific numbers. What our public health department does is that once a positive case is located, they work with this patient to determine who the patient has been in contact with in the days before their symptoms developed, in the days before they contracted the COVID-19 virus. And then they instruct those people that they've been in contact with a COVID-19 person, and that they should self-quarantine in order to protect themselves, and, well, particularly their family, the people that they know, their friends, and the community in general. So what this shows is that right now, and you can see the numbers as the efforts of our public health nurses have gone up, but right now they are monitoring somewhere between 150 and 175 people. They're working with this many people who've been in contact with a person who has tested positive for COVID-19. Our next slide shows you COVID-19 cases per 100,000 people. This is New Hampshire and Nashua and Hillsborough County specific. It's for the state, it's about 300 people, positive cases per 100,000. For Nashua and Hillsborough County, the numbers are higher because the cases are, for New Hampshire, are concentrated mostly, but not exclusively, mostly in southern New Hampshire, Hillsborough County, Rockingham County over near the seacoast, Manchester, Nashua, and the seacoast communities. So you can see that we in Nashua have had about 400 plus cases per 100,000 people. Now, in states where the infection is much more widespread, take New York or Massachusetts, that the number is much higher than 400. We know that there is a hot spot down in Boston, in Massachusetts, and that's one reason why we're trying to be very careful here. We don't want the level of infection that they've seen in our close neighbor to the south to emerge up here in New Hampshire, and so we are, again, trying to work together to make sure that does not happen. Now we'll go to the next slide, which is total COVID-19 tests versus percent positive. So what this tells you is the percentage of people who are tested who end up being positive. And you can see that the numbers, as the greater number of tests are done, that the percentage has tended to be between 7.5% and 10%. More recently, down near the lower level of that range, around 7.5%. Now, we don't think that 7.5% of people in New Hampshire have the virus because a person who has symptoms is more likely to be tested, but 7.5% is more than we'd like to see. However, in other places, I was just seeing a briefing on New York State. In certain parts of New York, they're testing 27% positive, not 7.5%, and in some particular neighborhoods, even higher than that. So this is an interesting figure, and it shows that as the number of positive tests has come down, that it may suggest that the prevalence of the virus is declining to some extent. The next few slides are directed to the issue of masks and the importance of wearing masks in public. Now, the scientific evidence suggests that the effectiveness of masks, they've begun to understand the effectiveness of these masks, even masks sewn at home. They don't have to be, N95 or anything like that. The effectiveness of masks is now better understood. And the scientists, the medical people, believe that masks are much more effective than they thought at the beginning of the pandemic. And the reason for that is that at first they were thinking that most of the spread of the virus occurred when a person speaks or sings or sneezes or coughs. Sometimes large droplets emerge from the person's mouth and respiratory system. And if these drops are large enough, they drop to the ground fairly quickly. And originally, the medical people thought that was the main vehicle of transmission. But as they have begun to look more carefully, and there's a lot of research being done, as they begin to look more carefully, the discovery has been made that actually the transmission is more likely to occur from much smaller, tiny, tiny droplets that emerge from a person doing anything, even breathing, but more talking, singing, coughing and sneezing, of course. But even talking or running, these things can emerge, this mist of particles can emerge from a person's lungs and, because they are so small, be suspended in the air for quite some time, for minutes. And therefore, a person that can have infected an area of a store or some other indoor space or even an outdoor space, have left the area and someone else can walk into that cloud of mist without, it can't be seen, of course, and might contract the disease that way. And the scientists and medical people think that's the main way that the disease is transmitted. Therefore, they're reaching the conclusion, or have reached the conclusion, that wearing masks is far more effective than they originally thought. And the reason for that is that it both protects the wearer of the mask from taking in any of this mist with the COVID-19 virus, and if a person is sick, has the virus but doesn't know it because they have no symptoms, it prevents that person from emitting the mist into the air to infect someone else. So the slide that you have in front of you on the screen asks the question, how much can we reduce the transmission rate with masks? And of course, there's quite a bit to it. There's a lot of information. But the bottom line conclusion, just to show you how effective this is, it says that if 60% of people wear masks, and if those masks are 60% effective in sort of protecting emission, that's enough to control the epidemic. So if people all around Nashua wear the masks when they're out in public, especially in enclosed spaces, stores, supermarkets, and anywhere else that's malls, indoors, but even outside if there are other people around, those are very effective in preventing the spread of the virus. Now, there's a couple of more slides here that are directed to the masks, and I'll just go through those quickly. The first is, of course, benefits of cloth face coverings or masks. It tells you that some of the information I've already discussed, that if a person coughs or sneezes through singing or talking, and that the particles can be emitted 6 feet or even further. Certainly, number two, we know that people can be infectious even though they have no symptoms. So there could be people walking around that seem perfectly fine, still they have the disease, still they could spread it to others. So the next bullet tells you that wearing a cloth mask prevents people from infecting others by keeping their droplets inside the face covering. But we also know that it is also true that it can protect the wearer from the mist, the very small droplets that are suspended in the air if they walk into the wrong place. Another benefit of masks is this is a very inexpensive way to attack the virus. We can have everybody, 100% of the population wearing masks. They can be homemade, and this can be done within a very short time. Certainly, they're talking about developing a vaccine. That's months, years away. Masks can be right away. And the cost of masks is low, a couple of dollars. These should be washed once you've used them for a while, a day or for a trip out. They can be washed and reused. And so they are very inexpensive. And the benefit, as we've discussed, of using the mask is quite large. Now, the next slide is the share of countries that mandate masks in public. And you can see that other countries are arriving at the conclusion that these masks are effective in preventing the spread, containing the spread of COVID-19, because more than 25% of the countries in the world now require the wearing of masks. That was almost zero just 2 months ago. So there's a major increase. Many more countries, one by one, are requiring masks because of the beneficial health effects that have been demonstrated from that. And I want to let you know that if you would like to, if you don't have a mask, if you don't have an access to that, there is free mask distribution taking place in Nashua every day between now and May 31st from 10 a.m. to 2 p.m. in front of City Hall. United Way is doing this in concert with a number of organizations, a lot of volunteers, and thank you to them. So if you want a mask, you don't have one, you don't know where to get one, you can get the masks right in front of City Hall from 10 to 2 every day from now till May 31st. Now I wanted to review for you the public health recommendations, and this is the next slide that you have heard before. First of all, again, wear homemade masks, wash your hands, avoid close contact with people who you're not familiar with, who you don't live with. Please avoid social gatherings or parties. You need to keep at least 6 feet from yourself and other people. And you need to work to modify your business environment to comply with social distancing, both being apart from people, and you've seen in many stores and the like, there are what are called sneeze guards, those plastic shields between the customer and the worker. Now, I wanted to let you know that the masks are being worn by, or the Board of Aldermen here in Nashua, because of the scientific evidence, is considering a requirement that in stores and other places where people gather, that masks be required not only for the employees, but for the customers. That protects the other customers. It protects the customers from each other. There could be someone in the store who is not symptomatic. And it also protects any transmission between the employee and the customer. Now, I know from talking with a number of our senior citizens over the last few weeks that most of our seniors are very aware of the risks of COVID-19 to them personally. Again, the senior citizens are more vulnerable to catching a very serious, even a fatal case of COVID-19. And they are being very careful, wearing masks and going out very, very selectively. But we observe that some of our young people are more less aware of the risks that they face. Now, yes, it is true that more people who are young survive and recover than the older people. But we know from looking what's happened in other states, New York, Massachusetts, there are certainly young people, even children, who have contracted COVID-19, have developed a serious case, and have passed away as a result. So to our younger people, the message is, look, I mean, none of us like to wear masks. None of us this is hard for everyone. Everyone is sacrificing in terms of changing their lives. But this is something important we're doing together. We'll look back and we'll know that we accomplished something very important when ultimately the COVID-19 virus succumbs to a vaccine or something, and we see that we clearly limited the number of sicknesses, the amount of sickness and death as a result of the virus. So to our young people, I say, you should listen to these cautions and use the same precautions that you see many of the senior citizens in our community using. As I was downtown last night, I drove through, I saw a lot of young people because outdoor dining has been authorized by the state of New Hampshire now. A lot of people around without wearing masks. I think that is, again, not the approach we should be taking, and everyone should be involved in this joint effort that we're undertaking to protect everyone in the community from this very serious disease. Now, before we conclude, I wanted to show you a couple of other slides. I believe we have a slide showing the banner over Main Street that congratulates the 2020 graduates. Unfortunately for our young graduates, our seniors in high school, There's no high school graduation this year. So we put up a banner. Public Works got this banner, and we put it up across Main Street to at least congratulate them in that way. Also with Public Works, on Arbor Day, and here's a slide showing the trees that were planted. At each of our high schools, Nashua North and Nashua South, the Public Works planted a tree in honor of the graduating class. Arbor Day, of course, celebrates trees and their beneficial effects across the United States. So we planted these trees, and we had the president of each of the senior classes present to witness what we were doing and to participate in this little ceremony we had. You can see we're exercising social discipline, and we are still trying to recognize the high school graduates. So before I conclude, I just wanted to stress again that we don't know exactly where we're going with this disease. The future is uncertain. We can begin to see the light at the light at the end of the tunnel. Some of our businesses are beginning to open, but it is important that we do this gradually, and it is important that we do it with the right degree of knowledge and expertise, so that we can maximize the chances that as the economy in Nashua reopens, as things return to some form of normal, that we minimize the risk that the disease, COVID-19, will emerge again in the same strength that we've seen it both in New Hampshire and particularly the virulence with which it has emerged in some of our neighboring states like Massachusetts. In any event, we're going to give you a weekly update, so we'll be back next week. But before I conclude exercising social discipline, I want to bring Ms. Bagley, Bobby Bagley, up so that she can tell you a little bit about the testing, then the tracing that the public health nurses do. And there is a clinic going on, again, a testing clinic this coming week, tomorrow, but she can tell you more of the details, as well as in the days that are coming. So thank you for tuning in. Please be well, be safe, and we'll be back to you in another week. And Bobby Bagley will come up right now.
Good afternoon. Hello, Nashua. I'm Bobby Bagley, the Director for the Division of Public Health and Community Services, and I'm here to talk about the testing clinics that we have ongoing. We really find that this is important for us to do. It's important for people to know their status about COVID-19 and if they've been infected. And so we are offering clinics. Tomorrow we have a clinic at 50 West Hollis Street, which is over at the church, St. Aloysius Church, or St. Louis de Ganza, or sometimes it's even referred to as the Spanish Church. There are different congregations that attend that church, but we do invite individuals who want to get tested to come to that testing site. We will be meeting there on Thursdays from 3 to 6 p.m. We do ask that people make an appointment, and so you do need to call our hotline, our COVID hotline, which is 589-3456. We have staff that are working the hotline between 8 and 9 p.m. every day, 7 days a week, and they will make an appointment for you if you feel that you need to be tested. So who do we want tested? Individuals who are over the age of 60, individuals who take care of other individuals that may have health conditions, individuals that may have visited with individuals either at the hospital or in other places and may believe that they may have been exposed to COVID-19. We also want individuals who are healthcare providers who have not had the opportunity to get tested through any other means, if not through their primary care providers or through Convenient MD or other venues that have been open to them. They're certainly welcome to attend the testing site as well. Individuals who have been in situations where they may have been around a large number of people at one time. Those individuals can also be tested. Or if you have signs and symptoms, If you've tried to get tested and your primary care provider could not provide testing for you, you can also come to that testing site at 50 West Hollis Street. Again, that's going to be on Thursday, tomorrow, from 3 to 6 p.m., and then each following week, we'll have that clinic as well on Thursdays. We're really excited about the opportunity to have this resource available to our Nashua residents and individuals in the greater Nashua area as well. But then also look for some of the other opportunities that the state has made available for testing, either through Convenient MD or through your primary care provider or other organizations that are offering testing. The reason why it's important is because as we identify individuals whose tests may come back positive, we can then do contact investigation and contact tracing, which allows for us to then make sure that people are educated about isolation and about quarantine, so we can again keep the spread of this infection under control. We're looking forward to the opportunity where we can continue to open up venues and activities wisely in the city of Nashua and in the state of New Hampshire, but we want to do that very intentionally with the purpose of making sure we don't cause more spread of infection as we engage in some of these activities. And so if you are sick, not feeling well, have any of the symptoms that are related to this infectious respiratory illness, we do still ask you to stay at home. Don't go out to the restaurants. Don't go out into the retail establishments without, if you have any of those signs or symptoms. The mayor talked about the importance of masks. In public health, we could not reiterate that any louder than what he has already or any more clearly. It's important to make sure that you wear your facial coverings when you're out in public, whether you have signs or symptoms of any respiratory illness or not, because this virus has been spread asymptomatically. And we know that we can stop the spread by creating certain barriers, such as wearing the face mask when we're out in public. And again, I'm going to say what I always say about the hands. Washing of your hands is very important, and making sure that you're not touching your face, your eyes, your nose, or your mouth, or even when you have your mask on, not touching your mask either. It's really important for us to continue to maintain a decrease in infection and make sure that we can continue to keep our community safe as we continue to come out of this event, and do it very wisely and do it intentionally with the thought of keeping ourselves safe as well as our family and fellow community members. Thank you, Nashua, and we appreciate everyone working together with us to help stop COVID-19 from spreading.